Black Friday, everybody. It's Dr. Linda, President and Founder of the Vascular Birthmarks Foundation, live today with VBF, Sturge-Weber Syndrome expert, Dr. Ann Comi. Welcome, Dr. Comi, to the VBF Facebook Live.
Hello, everyone.
And I hope that you had a great Thanksgiving.
I did. I really have enjoyed it with my family.
And I would like those of you that are on, I see there's 3 of you on, if you could give me a thumbs up before we start taking questions. I've got to log in on here so that I can see the questions on my phone.
Black Friday.
Oh, here we are. Got to turn the volume off. Turn the volume down and just see us live. So do we see some indications that you can see us? Oh, hi, Ricky. Thank you, Ricky. Ricky LaPrade, thank you for letting us know that you can see us. I'm still synchronizing here with my phone where the questions come through a lot easier. So I should see it. Here we go. All right. So we have, thank you, Ricky. So we are here today. Hi, Michelle, and 7 other people who are watching us. Hi, Michelle. Hi, Sean. So I can see them all on here when they're popping on. Kelly Ann. So we're here today. We VBF focused November on Sturge-Weber syndrome awareness. We have this wonderful booklet that Dr. Comi and myself did, which was the top 50 questions that have been asked to us over the years about Sturge-Weber. This is free on our website at birthmark.org. And when you click on the Sturge-Weber syndrome icon or image, you will see this booklet if you want a hard copy, which is very nice, nice in color, all illustrated. For any donation to VBF, you just ask for this and we'll send you the hard copy. So we are ready to take your questions, all things Sturge-Weber today, and everybody's saying hi. So we have 19 people on, 17 it says on here, 17. So please send us any questions regarding port wine stain and its connection to Sturge-Weber syndrome, and even those rare cases when there is no port wine stain. When do you need to do imaging? When should you start treatment? Dr. Comi and I talk a lot about prevention.
Right.
Especially, there's a lot of the babies that have a very high probability of developing Sturge-Weber because of the location, the intensity, and we want to watch those. We want to watch them closely because there is a strong possibility they could end up with glaucoma or possible seizure. So we're trying to get more and more awareness. There's still a lot of misinformation out there. Babies are getting imaging done at a month old and the parents are told, oh, it's all clean, you don't have to worry about it.
Right.
And that's not true, right?
No, it's not. So we don't talk about a V1 distribution anymore because it really doesn't we know now that there's the underlying mutation and it has nothing to do with the branch of the V1 distribution of the nerve. It's developmental, and it's port wine birthmark on the forehead, the upper eyelid, lower eyelid, temple area. That's the high risk area. So patients who have a port wine birthmark there are at risk for abnormal blood vessels in the brain and the eye, and all the issues that can come along with that.
Thank you for that. So Christy has a question. Hi, Christy. Our daughter is 7 and has been seizure-free for almost 6 years. She's eligible for the COVID vaccine. Do you recommend it? And are there any things we should be on the lookout for once we get it?
I do have many patients who've gotten the COVID vaccine, they have Sturge-Weber syndrome. Most of them are a little bit older. It would be great for this group to sort of continue to take in information about how the younger group of children do with the vaccine, but the patients that I've had have all done fine with it. Either had no issues at all or just like some arm soreness, 1 or 2 with headaches, but I haven't seen anyone where the vaccine has caused obvious issues with seizures or strokes or anything like that. So
And we did do a study, but it was mostly adults, and the ones that had the port wine stain in that distribution, the comments of the darkening or the burning, and they had either had COVID or the vaccine, it could have been related to the fact that they just hadn't had treatment in a couple years. So it was really hard to
Right.
make an inference when you can't isolate all the variables.
Right.
So we just know that 18% did report changes to the birthmark. So we have a question. Madison Marklowitz says, if a child is cleared of brain involvement at 24 months, what are the chances of glaucoma developing later in life? And does that clearance at 24 months mean it's cleared?
So we're talking about the eye here, right, and the glaucoma, and no, the glaucoma can develop at any time, with peak periods being in infancy and early childhood, and then later in young adulthood. So they have to continue to be monitored at least yearly, even if things are fine after the first few years of life.
Well, and that's for the glaucoma.
That's for the glaucoma. For the brain,
Now she's 24 months and she was cleared.
yeah. So the question is, how was she cleared? And to make sure that the imaging was done with contrast and the necessary sequences to be able to ensure that the imaging truly was negative. If it was done with contrast and the sequences that are needed, then I'm happy if there's any question to view imaging if family gets in touch with me, because on occasion the imaging is called normal and it's not. So
Yeah, that's very important. Tara Nesbitt said, should one revisit the possibility with progression in the event of change? I have a facial port wine stain running over the eye. I do have glaucoma. I'm 50. My screening was done as a baby, but never revisited. Should I be concerned about change or have more testing done at this age? And I think she's probably talking about maybe
the brain,
the brain
yeah.
involvement.
So I have had patients who have presented with their first seizure, stroke-like episode, or severe migraines in their 30s, 40s, 50s, 60s. So it's possible, and certainly the imaging that would have been done when you were a baby 50 years ago, we have much better imaging now. Probably it was just a head CT then. So I would say certainly if there's headaches or any memory concerns or cognitive concerns, new symptoms happening, you would want to get the appropriate imaging with MRI without contrast. If you're not having any symptoms and you just want to know for sure, you would still need to do that testing.
Thank you. That's a great answer. So Sarah says, my son is 4 months old and has had 4 laser treatments so far. The port wine is on his cheek and lip. What's the chance of this lightening to a certain degree?
Yeah, so that's it's really difficult for me to. I mean, it's almost certainly going to lighten. Without seeing it, I wouldn't be the best person to ask. There are other experts who actually do the laser who would have more information on that.
There was a recent study I was reading too about test. It was done in Europe somewhere where they're measuring how much it lightens the color change variation in the port wine stain, and they noted change. But because they're using like a Pantone color software,
Yeah.
it's very variable. So
Well,
I find
right.
it very
So,
interesting.
if one is going to look at that, it needs to be done in the same lighting, at the same temperature,
Right.
with the same
time of
camera,
day,
same
same-
time of day, because the birthmark can vary
Yeah.
in darkness. And
So Merek says, all the best to you, and says Alex is 9 years old. He had an operation at St. Joseph's Hospital in Berlin 12 times. I'm not sure what the question is, but with all these surgeries, I'm not sure if he's talking for Sturge-Weber or
for
Yeah,
his
you'll
for
have
the
to-
eye or
yeah,
the skin.
I don't know because he didn't say. He just said operated 12 times to date. in Eberswald. So Mark, maybe you could tell us what you need to know. Lauren Sheehan says, how often should one have imaging done, MRI with and without contrast, EEG, etc., throughout a child's development? Our daughter had imaging done around 2, but is now 7. What factors determine new imaging to be reconsidered?
So I will often think about EEG first. So if there is plateauing in development, or certainly regression in cognitive development or neurologic function, an EEG can be done without sedation and will help to look at whether we often do a overnight EEG or a couple day EEG to see if there's any issues with seizure activity that's just not being picked up. And on occasion that is diagnosed, and then we have to appropriately treat the seizures. In terms of, but I don't do it every year. So if the child is doing really well, is making great progress, not having apparent seizures, being hospitalized overnight can cause issues in and of itself, emotionally, behaviorally. That's the first thing that I'll think about. And then imaging often is very stable, even when there are issues. So I don't do imaging on a yearly basis because we have to sedate and we have to give contrast. And so if there are worsening headaches, strokes or stroke-like episodes, seizures, a deterioration of function, a plateauing of development, then we consider getting imaging as well, depending on, history, exam. Frequently, if the child ends up having worsening seizures or strokes or stroke-like episodes or complicated migraines with headache with neurologic symptoms, then we'll get imaging to make sure that nothing has changed.
Okay, great question coming up. I'm pretty sure you know this guy, Dr. Sean Lichty. His daughter has Sturge-Weber syndrome. Great, he participated in our day on Capitol Hill and he did a phenomenal job.
Excellent.
He wants to know if there's anything new at all with gene therapy or for the glaucoma or the seizures. Is there anything new that you could share?
Yeah, so there are, so here's new that is an evolving story, is that most patients have the GNAQ mutation. However, some have something else, and that is still an area in progress to determine who should have genetic testing and why and when does it make a difference. And for me right now, so there's the publication of the GNA11 mutation, which is a gene very similar to GNAQ, and then a patient with the GNB2 mutation. And so right now, I have been recommending skin biopsy or blood, depending on the extent of involvement, in patients who have atypical presentations. And so I think we're going to be figuring out more there, what difference that makes. Certainly down the road, it'll be important for patients to have a genetic diagnosis for targeted treatment. So that is an area that is evolving right now. And there'll be presentations and papers, I'm sure, coming out in the coming year on that. Otherwise, we have a couple of trials, one that is being written up now on additional studies of Epidiolex, and we just in the last year had a pilot trial come out on the use of sirolimus, which is an mTOR inhibitor, and we're working to try to develop larger follow-up trials for both of those.
It's very interesting because everything's looking at those MMP inhibitors,
Yes,
And
so there are other inhibitors that are being looked at, and that's part of the reason why it'll be important down the road for people to have their own genetic diagnosis.
they're doing that for AVMs right now as well, and all things vascular should be related, and you should find an exact mutation so then you can match it to the exact anti-seizure med or the whatever.
The
Because there
exact,
are-
down the road, the exact inhibitor.
The exact inhibitor.
Yeah.
Right. It's phenomenal. So Merrick's writing again, but Merrick, we need to know what the birthmark type is and what your question is. He's just listing the doctors that he's worked with, which is Dr. Fay and Berenstein, and that's great, but we don't know what your question is or what your birthmark type is, so if we could enter that. Sarah Jackson Nelson writes, her 4-month-old got an EEG, and it did show signs of Sturge-Weber. The doctor is saying they can't officially diagnose it until 12-month MRI. Is there anything I need to be pushing for?
So if you haven't, so I do history, exam, EEG, and if any of those are concerning, then go ahead and proceed with early imaging, because early imaging can be negative and we have to repeat it after a year of age. But if there are signs of problems, then that increases the likelihood that the early imaging will be diagnostic. And if we see Sturge-Weber syndrome on the early imaging, then we know. We don't have to wait, and we can contemplate or think about or discuss pre-symptomatic treatment to prevent the onset of seizures, or if we can't prevent, then reduce the severity of the initial seizures so the child is less likely to have deterioration in function.
Very good. So again, I'm trying to get, Merrick keeps trying to ask a question, but sorry, Merrick, just tell us, we can't click on any links or look at images while we're live right now. So just tell us what Alex's diagnosis is, and then we'll be able to see. Oh, I don't know why this was interrupted. It said it was interrupted. So anyways, while we're waiting for some additional, oh, hi Robin, how are you? So some additional questions regarding Sturge-Weber. One of the things I wanted to talk about is, we have a new board member, Tricia, and she's doing a lot of wonderful work with preparing families for the services that they would have available in their community. And
So important.
Yeah, I just can't speak enough about that there are a lot of families that have children that are ready for school that have Sturge-Weber, and they don't know these services are available. So,
And just the diagnosis of Sturge-Weber syndrome will open up and services in terms of therapies, in terms of monitoring, in terms of early testing, school, prior to getting into school. So having that diagnosis in most places will really open up a lot of services.
yeah, and it's very important that the families know about these and take advantage, because it really makes a difference. It really does. So Ashley writes, our neurologist told us to begin with an ultrasound before MRI, which I don't understand that, to delay MRI until a little later. My son is 3 months old. He has the port wine on the right eyelid, forehead, and scalp. So what is an ultrasound?
So when the font is still open, then they can, use ultrasound, which will give a picture of the brain. And if there's great abnormality of the brain, then they may be able to pick something up. We don't make the diagnosis of Sturge-Weber syndrome with just ultrasound. Once the font gets very small, ultrasound isn't going to be helpful. They can sometimes do transcranial Doppler using sort of similar technology to look at blood flow in the major vessels and look for abnormality. There's been some indication in the literature that may be helpful. I don't think it's been well worked out, but it really depends on what you have available to you too, because ultrasound TTD is very technician dependent. So if you've got availability of a great pediatric neonatal ultrasound technician, it might be helpful. But we make the diagnosis on MRI. So if there's issues of concern, an MRI should be done. We can't see the abnormal blood vessels on the surface of the brain, that's diagnostic of Sturge-Weber syndrome without doing the MRI with contrast currently.
Okay, that's very good to know. Ashley wants to know, is there a high risk area for Sturge-Weber syndrome? And if it's true, which there is, what is the chance and what percent of people never get Sturge-Weber that are in that high risk area?
So we talked about before that the high risk area is the forehead. Occasionally it can be midline forehead, but forehead, one or both sides, the upper eyelid, the lower eyelid, and the temple area. And so the risk depends on the size of the birthmark. So a small birthmark that just involves a small part of this area, the eyelid, the temple area, has about a 20-25% chance of brain or eye involvement. If it covers both the upper and the lower eyelids, then the risk for that child of glaucoma is around 50%. If it covers most of the entire side of the face, then the risk goes up to about 30%. And if it's both sides of the face, most of the face, then it ranges anywhere up to 40 or 50% chance of brain and or eye involvement.
My son has a port wine stain. This is another question from Kimberly Ann. My son has a port wine stain on his neck and half of his scalp. I was told he is not at risk for Sturge-Weber. Would he be at risk for glaucoma and Sturge-Weber?
So the neck, no. The scalp, not forehead, and not temple area, but actual scalp where the hair is, does not have a high risk of Sturge-Weber syndrome per se. But when the birthmark is large, it's a good idea to take a look at the brain at some point in any case, because when they're very large vascular birthmarks around over the head, the scalp, there can be a variety of underlying vascular or structural images in the brain. It's just a good idea to take a look. Same thing if there's a large vascular birthmark over the spine. It can be important to make sure that everything is okay in the spine too.
This Ashley Hedrick has a really great question, and I think you've discussed this in the past. But her son has the facial port wine, but he also has a protruding forehead.
Yeah.
And so, is that an indication? Do you see some skull or?
Well, so just to understand, so if there's a protruding forehead and the head is large, and the medical term is macrocephaly, then and there's a port wine, there's a capillary malformation birthmark. We have to think about the possibility of capillary malformation macrocephaly syndrome, which can present with a protruding forehead, large head, vascular birthmark, and it's caused by a different gene. And that genetic mutation can be more associated with overgrowth type phenotypes, and actually an increased risk of cancer too if the birthmark is widespread. So, like I said before, when we're seeing atypical presentation, it's more important to think about doing genetic testing.
And save that information because everything is evolving and you'll want to keep those records.
That's right. Absolutely.
So another question is, if my son has a port wine stain covering his temple and it's very large, would he be at risk for Sturge-Weber?
Yes, so the temple, it is one of the high risk areas that we, and if it's very large, I'm not sure what they mean exactly. If it's covering down onto the cheek and up into the forehead, even higher risk. But the temple area has been identified as a high risk area.
And then the same mom wants to know, she said his port wine also covers his chest and his throat. Would he be at risk for any swallowing problems?
Well, so we want to make sure that an echocardiogram is done to look at the heart. So if there's a capillary malformation over a lot of the chest. That should, on occasion we see a patient who they do an echo and they find that there's a structural abnormality of the heart. And we don't see airway issues very often with capillary malformations, except we can, like in the nose and upper airways. Very, very rarely there's a child who actually has sort of issues with the airway. So if breathing problems develop or lots of snoring, then we have to evaluate that.
It's important. Christy Bickings Ebels wants to know, what is an atypical presentation of a stain?
Yeah, so very extensive, lots of hypertrophy in a young child. That can certainly happen as someone gets older, but seeing that lots of bony or soft tissue hypertrophy at a very young age. The large head that we talked about, or the birthmark just doesn't have, it has a different appearance. It's not the sort of typical reddish pink solid birthmark, but it has a different appearance. We have to think about other possibilities.
Now, I just had a mom write to me the other day, and I knew I would be on with you today, so I told her, I would ask the question. But her son has been diagnosed with not glaucoma, but a type of retinopathy, and he has the really extensive port wine stain, and he's had 2 pediatric eye exams. I've not heard of this. But I thought, well, are there other eye abnormalities other than glaucoma? Can there be a retinopathy or?
There can be abnormal, retinopathy is a very sort of general term, so I'm not sure exactly what that means. Typically we see enlarged dilated vessels that can be in different areas of the eye, and so I'm not entirely sure what the retinopathy is. That abnormal blood vessels in the retina, or exactly what they're referring to there. But glaucoma is increased pressure causing injury to the optic nerve. There can be, without glaucoma, there can be other structural abnormalities or abnormal blood vessels, but not yet glaucoma, meaning increased pressure that injures the optic nerve.
Great. This is a phenomenal question we have from Ashley Miller. She said she did 3 to 4 laser treatments in the first year and a half of her daughter's life. Then they took a break once the dermatologist recommended it need to be done under anesthesia. But due to her daughter's seizures not being controlled and fear of procedures causing seizures, we have not returned to them. She is 3.5, and we have not resumed laser treatments. Are we doing any harm in waiting till she's a little older to begin?
So that's a difficult question. I can't really speak without sort of more information exactly to your situation, but I can try to provide some general information that maybe you can apply. So I have lots of babies who, with Sturge-Weber syndrome brain involvement and or eye involvement, who have had laser and tolerated it just fine. And so I don't recommend that everyone with Sturge-Weber syndrome delay laser, because early laser is quite effective, and I don't see many patients where it seems to be triggering issues. I have a few who had laser and then had seizures with that. And for those patients, we talk about it and think about whether they want to delay additional laser. But most tolerate the laser just fine, do great with it, and it doesn't seem to be. We also studied directly doing laser around the eye and whether that caused any issues, and we did not find. We actually measured pressures before and after laser and didn't find that pressures were going up, and a couple of sort of retrospective studies have been done by ourselves and others, and also did not suggest that laser was causing any problems in the eyes.
Well, that's really good to know. Robin Duarte wants to know, she's curious about auditory and ear issues when the birthmark goes into the ear.
So yes, we can see increased risk or frequency of ear infections in the little ones on that side, and repeated ear infections can certainly contribute to hearing issues. If there's actual obstruction because of hypertrophy of this skin and soft tissue within the ear obstructing the canal, or there may be obstruction of the drainage to that ear. So we do see problems with ear infections, and frequently we'll recommend the tubes be placed if the child is having repeated ear infections. And on occasion, hearing issues, yes. That's not a very frequent thing, but on occasion, yes.
Very good. Ashley Miller wants to know, the birthmark is small on the side of the nose, right eyelid and right eyebrow area, midline forehead. But she said fainted drastically with the few lasers we did. I don't know if she means fainted.
Faded?
Faded?
Yeah.
Oh, faded, maybe. I don't know.
And what's the question?
I don't know.
Okay.
So she'll have to ask the question again. So we'll go to Lindsay. My son has a V3, Port Weinstein, that goes up into his scalp head. No eye involvement. He just turned 1 and he's walking, meeting milestones, saying words and names in Spanish and English. Bravo to him, right? That's awesome. Uses sign language too. No signs of seizure. Do we need to do the MRI for Sturge-Weber now, or how long could we wait? His third laser treatment is with Dr. Geronimus in January.
Okay, so V3, or what what we talk about in terms of V3 is sort of here, and then
She's saying it
the
goes
scalp.
up into the scalp.
Right, so if it's very large, it's a good idea at some point to do imaging to just make sure that all the vascular and structure of the brain is fine. I don't know that that we have a definite cutoff time, but I would think anytime after a year there but probably we could look even earlier. So if you're concerned about sedating and the child is doing great, then wait until after a year or two of life. Most of those children are going to be fine. It's certainly not associated with typical Sturge-Weber syndrome, that distribution of the birthmark.
Thank you. And welcome Corinne. I see Corinne is on. She just got on. And then Kimberly says hello to you from Canada, and she wants to know if you do virtual consults.
I do virtual. The Kennedy is allowing me to do that.
And this is awesome, and you can directly get in touch with Dr. Comi through the VBF at birthmark.org/Comi, C-O-M-I. That's how you can email her directly, or you can email us and we can get you in contact with her. Also, her office contact information is on our website at birthmark.org. Find an expert, and under Maryland, you'll see Dr. Comi at the Kennedy Krieger Institute for Sturge-Weber syndrome.
Yeah, so we ask people to send records and imaging so that those can be directly reviewed, and then Zoom can be set up.
Yep. And Emily says hello. She's checking in on her way, heading up to visit family. And Corinne's got her 4 boys home, so
Nice.
everybody's home for Thanksgiving. So another question is, if the baby's has red dots on their eyeball at birth, should they be concerned? And you and I have
Yes.
talked about this. She said there's no glaucoma, but the baby has these red dots on her globe.
Yeah, so if the the eye that's on the same side as the birthmark is showing a larger amount of blood vessels on the white part of the eye or the eye itself. That child has a greatly increased chance of, even if they don't have an increased pressure now, of developing increased pressure and problems in the eye. They need to be monitored closely. So every few months until they're old enough to be able to complain of pain and vision issues.
Thank you for that. And Merrick, I know you're trying to still communicate with us. If you want, just email me at vbfpresident@gmail.com, or you can friend me on Facebook. I'm the only Linda Roselle Shannon, ROZELL Shannon, SHANNON. So maybe we can continue this discussion and find out the type of birthmark that Alex has and make sure. I know, sounds like you're in good hands because you're with Dr. Weiner and Dr. Berenstein, but I do want to answer your questions. So I know you've been trying to communicate with us on this forum, so I don't want to lose sight of that. Okay, so we have much more. Kimberly just said thank you for that. And let's see. So also, while we're waiting for the next question, the VBF conference will be in California on October 8th, Saturday, October 8th. Dr. Comi will be there, along with her colleague, Dr. Anna Pinto, who we love, another Sturge-Weber expert, and Dr. Cohen, who is another one of her longtime colleagues, and our Port Weinstein laser treatment expert, Pete Derm. So if you will keep your eyes open, because around mid-January, February 1st, we open registrations, and she was at our super clinic that we just had. That was kind of crazy, but it was
fun.
It was a full house, and
Yes,
it was a full house. So we do everything that we can during COVID to be compliant with the laws and the rules. Everyone was masked, but we were still able to provide the services. So Lordon is on, and she said, thank you for the opportunity to ask questions. Is there a possibility, by your experience, that someone has the presence of dilated capillaries in the eye or near the brain without developing glaucoma or seizures?
So yes, it's possible. The vast majority, so depending on the extent of brain involvement, about 90 to 95% or more of patients who have brain involvement will develop epilepsy at some point, but not all. It is possible. And less typical involvement is more associated with headaches and migraines than seizures later on. So there are some patients who don't develop seizures, but later on develop bad migraines and headaches. In terms of the eye, yes, it's certainly possible to have some dilated blood vessels and not develop glaucoma yet, but that has to be monitored for life. So we can have someone who doesn't have glaucoma now, who has port wine birthmark and some abnormal blood vessels in the eye, and they don't have glaucoma now, meaning their pressure is okay, and the optic nerve, the nerve in the back of the eye that connects to the brain, isn't injured, but that could still develop later on, and so that child needs to continue to be monitored, for life.
And that's the problem. Like Lordana came and stayed in the U.S. for 3 months with her son David and her husband. They came from Croatia because there's no one there that understands Sturge-Weber or does early intervention. So she was getting all the laser treatments, and we helped her coordinate with Dr. Kane to do an eye exam, which he did. Now the unfortunate thing is when she goes home, there's no one there. She can get the laser for free anytime when we have it in Milan, but that's not going to help her with annual glaucoma checks. I just wish there'd be more and more experts that could offer this to these kids, because it's very hard. I just had a mom yesterday say she's in Maryland too, and I was going to talk to you about this, that she's trying to get her son in to get tested for glaucoma, but the glaucoma expert in the Baltimore area, there was two, like Baltimore Derm ophthalmology, and then I think one at the university, but they said they can't take any new patients, and I'm like, that's crazy. This kid's got to be seen.
Have them reach out to me.
Oh, I was going to
we'll
ask you. That's
facilitate
great.
things. Yeah.
Perfect. She may even be on. Have you ever heard of cases of port wine stain and endometriosis?
I have not heard about that. I guess the immediate question I would have is whether the birthmark extends into the pelvic area, abdomen, pelvis, upper legs. I would be curious to know that, but no, I have not seen that frequently.
Well, too, though, with extensive Klippel-Trenaunay syndrome.
Yes.
If they have the bone, the muscle, and the tissue involved, and it is in the gastrointestinal area. Where
the pelvis.
Yeah, the pelvis.
Yeah.
They can have.
Right.
Right.
Yeah, so that's what I mean, there are some patients who have both Sturge-Weber syndrome and KT.
Exactly. Yeah, we had a former president of VBF, John, who was a lawyer, and he had Sturge-Weber and KTS, both, working as a former AG with Department of Workers' Compensation in New York State. So now Lisa says her daughter has a small port wine stain on her forehead, slightly to the left. She also has a small, different type of birthmark on her left eyelid. The pressure in her eye is elevated, and we see the genetics team and the eye doctor on Wednesday. Should I push for Sturge-Weber testing? Sounds to me like she should.
Yes, it would be important to be evaluated by a neurologist if possible. I don't know where you are. But.
Yeah, I don't know where she is either, but try to find a pediatric neurologist, Lisa, that, obviously they're seeing something, they want you to go for genetics, and there's pressure, so they have something on the ball, because they understand this, that they're not just brushing it off, so should definitely get that checked. All right, Melinda wants to know, have you ever heard of cases of port wine? Oh, no, that was the same thing on the endometriosis. It just repeated the question twice. So you mentioned a little bit about the gene, the GNAQ, and now you mentioned also, now we're seeing some more subtypes. There's the GNAQ-B, I guess you called it, or 2.
So GNA11 is
GNA.
It's a paralog, meaning it's a very similar gene to GNAQ and serves a similar function. There may be, in the last year or so, been a few series looking at GNAQ versus GNA11, and it's not entirely clear if we can tell the difference between them clinically, or they're at risk for different things. Maybe particularly if the birthmark involves the torso, the trunk, maybe blood pressure issues, and the need to look at the kidneys. More with GNA11, maybe. It's not entirely clear. And maybe the birthmarks have sort of a similar, a different appearance with some of the other genes that we're seeing. So it's for many years after we identified the GNAQ mutation, I wasn't sort of actively advising patients to get genetic testing, because knowing the gene wasn't going to help diagnose brain or eye involvement. That still had to be done with monitoring and imaging. But now as I'm seeing more and more patients who have features that are a little bit atypical, we're realizing that the GNAQ mutation is still the most common, particularly for very typical presenting patients, but there are other mutations that are being diagnosed, and figuring that out is going to be important. We're working on that. Other people are working on that. There'll be more cases and series reported in the literature soon, and hopefully we'll be able to, hopefully knowing those results will, one, help with prognosis, and two, eventually help with recruiting the right patients into the right trials to treat their symptoms.
Well, I wanted to give you a little bit of further information from Lisa, the one that had the lesion on the eye and was working on the genetics and recommended the Sturge-Weber. She's with the University of Minnesota, so that's where they're doing it.
Yeah.
So
Okay.
I think
Good.
they yeah,
Good hands there.
yeah. So
And can certainly reach out.
yeah, and follow through on that. The other thing is, VBF, I had a meeting with the physician from the state of Washington who has the big genetics testing lab, and he is working on a reduced flat VBF fee
Great.
with for focus vascular anomalies genetic testing, and that'll be out next year.
That's fantastic.
So we're gonna do matching like fundraisers, because if we can get it, right now it's like around 1,500. If we can get it down to 750 and then do matching, then the family only has to pay $3 something.
Right,
And-
which would be great. I mean, that's been a hindrance to this. We're trying to get as much information together so we can justify testing, but it's a struggle, and so having that available to families at a reasonable price will be excellent.
And it'd be great for us too, for having another service that we can help with. Melinda says her daughter is 24 and her port wine stain is near and around her eye. She has developed a cataract, which was bad enough to get taken off. Not sure if there is a connection.
There is a connection. Does she also have
Her
increased pressure?
Her pressures
Yeah.
run very high.
Yeah, so yeah,
Or high
elevated
normal.
pressure over time can result in cataracts as well as many other issues. So continuing to work with their specialist, the glaucoma specialist, to try to bring those pressures down will be important.
Yep. Lauren wants to know, so Lauren, you can email me at birthmark.org or vbfpresident@gmail.com to connect you with Tricia, our board member, that's assisting families with getting the information on the services they need through their communities, their counties, and their school districts. So if you want to just email me, I'll do an introductory email between you and Tricia, Lauren. Or you can even look, she might even be, because she's very new, she just came on our board this month, where our board of directors is. She might be there as our Sturge-Weber syndrome parent rep. But otherwise, you can just contact me and I'll do that introduction. So that's very interesting, because I had wanted to know, I was curious that if they had, as babies, if they do get diagnosed with glaucoma, should the parents be told to tell them as they get into their adult years to watch out for cataracts?
Yes, absolutely. So more blurred vision, difficulty with night vision, driving.
Yeah, I hear that a lot. I hear that there's a couple guys that I know in my community that have Sturge-Weber and they just have never had their glaucoma. They don't even do their drops. They're just stubborn. And one of them called me up like a month ago and he's like, I can't even see when I'm driving at night. And I'm like, get your darn eyes checked.
Well, and the thing is too, I mean, there are some patients who, even with surgery, even with drops, lose vision. It's still important to work on bringing the pressure down, because it can cause pain. If the pressure remains uncontrolled, even if vision is already impaired, it can cause lots of pain. And
is that true for babies too? Like if they have the glaucoma and it's not treated, they can have pain?
presumably so. It's hard to ask a baby,
Right.
But
But I mean,
yes.
I just think that's important for parents to know, to get the eye checked if it's in that zone.
Well, right. So, and a little bit older patients, patients with Sturge-Weber syndrome are at risk for migraines and headaches as well. But if the headache is localized, in and around the eye that's involved, then the cause of the pain or the trigger in the headaches could be glaucoma.
So again, very important to have those checkups
Right.
done. And I tell the parents, they're like, "Oh no, my child's never going to get glaucoma. They already had a test."
Yeah, no, that doesn't.
It's lifetime. I try to
Right.
tell them.
And I have seen patients who were told that early on and did not have regular monitoring done, and then by the time they got a check, they'd already, had permanent damage to the optic nerve and permanent vision loss.
So again,
Yeah, kids can't be relied on to sort of, complain about that.
no, because they don't know. I grew up with that myself, where I had the cross eye, and it was operated on, but I couldn't articulate to my mother that I still couldn't see out of that eye because I had already compensated to use the right eye.
Right.
And my mom didn't know what to ask me, and I didn't know to tell her because
Right.
it was just what was normal to me. So that's why the parents have to.
Kids have to be monitored, and again into adulthood though too, because they can be no glaucoma, and then young adults or older adults develop glaucoma.
So Kellyanne has a question. She says, "I worry that in my area, rural New Mexico, there are no adequate services. My daughter has a port wine on much of her scalp, stretching to her temple, ear, upper cheek. She shows no signs of involvement so far and has received 3 laser treatments. Her 18-month-old well child checkup is next month. I want to request referrals for MRI and for eye checks. Can you confirm for me the type of specialist I should request? Should it be pediatric neurology
Yes,
and pediatric ophthalmology for annual screenings?"
correct. Yes.
So actually, you did a pretty good job of explaining all that and indicating what you needed, Kelly.
Yes.
So good job for you. And, bravo in rural New Mexico that she found someone to do the laser treatments. That's amazing. So we have 8 minutes left. And again, we have the Sturge-Weber Syndrome Frequently Asked Questions booklet. It's on our website at birthmark.org. If you click on the image and the name that says Sturge-Weber Syndrome, you'll see the 9 birthmark types on our website. This pops right up. You can read it for no cost, but if you want the hard copy, here it is. You make a donation, and we will send that out in the mail to you. And we can take a couple more questions before we fold. You've already... and all of Dr. Comi's, if you have a baby with port wine in the distribution that she's talked about, we have our Facebook Lives that go back to 2017, and we will be listing them now all on our Sturge-Weber page as we get our new parent packet put together on our websites. So you'll see the links from 2017, 2018. We do it Black Friday.
Yes, that's
It's
our
our
tradition
thing.
now.
It's our tradition. And we, it's great lead up for Giving Tuesday. Giving Tuesday is this week,
Yeah.
and we've had this whole month of awareness for Sturge-Weber with the More Than a Birthmark, with our PAN, and that's another thing for you parents. We have the Parent Advocacy Network, and they do monthly Zooms, so you can get on with our Patient Advocate Director, Corinne Baranaga, and you can write to Emily at birthmark.org to get the list of the topics. I know January is going to be hemangiomas, but every month we have a different topic, and the parents all join that Zoom session and ask questions. So, birthmark.org is your website to go to find out all the services that we have. And we also have 6 free laser clinics coming up next
Wow.
year. We have one in a couple weeks, actually next week, December 4th, in Texas with Dr. Friedman. We have one in January with Dr. Duarte, and Miami at Nicholas Children's. Then the next one is March with Dr. Coletti in Milan. And we'll be in Greece in July, and we will have free laser in Greece in July. And then the conference in October, we have lasers. So we're very excited about that service.
Super.
Ricky Laprade says, thank you for all you're doing. We are 2 years into our Sturge-Weber journey, but always pick up something new each time we tune in. And that's what we want, right?
Yes.
We want to keep it current.
I always want to be moving ahead.
Keep it current, and but also reinforcing those basics.
Yes.
If the baby has a port wine in these areas, the 3 things you need to know is early intervention for the laser. The baby's face is only this big,
Yeah.
and it can be done really quick, and you don't need anesthesia.
Right.
Get the eye checked as soon as possible.
That's right.
And the imaging should be done at age 1, unless there's some
Unless
signs,
there's issues.
unless there's signs of seizures. And before we leave, you do a really great job of explaining to the parents what these subtle seizures may look like. So if you could
Okay.
do that.
Right. So patients with Sturge-Weber syndrome generally do not have big shaking all over the body seizures. They can be quite subtle. Your video camera is your friend, because if you're seeing something repeatedly and you're not sure what it is, videotape it and you can share that. But it's they're focal seizures, meaning, so if the birthmark is on, say, the left side of the brain is what we're most worried about, and the left side of the brain causes right-sided twitching. So not just a couple of twitches, but it goes on and on and on, 30 seconds, a minute, 2 minutes, 3 minutes, and it can be twitching in the foot. Again, not just a couple of twitches, because babies don't have coordinated movement, but rhythmic twitching that's going on and on and on. You can't make it stop it. You try to interact with the child, it just keeps going. It can be the eyes deviating and bouncing. So again, if we're worried about right-sided brain involvement, that deviates the eyes to the left and they will bounce. It can be the side of the face, rhythmically twitching. On occasion, a child will have just staring and just not moving less and not responsive. That can be harder, but again, you can't sort of stimulate a child out of a seizure. So if you pick them up, you interact with them, and they stop staring, they orient to you, not a seizure. If you try to interact with the child and just nothing, we have to be concerned about the possibility of seizures. In about 10%, 5 to 10%, so less commonly, it can be infantile spasms, which look like this, and then a few seconds later again, and a few seconds again, or sometimes it can be this way, and then a few seconds. That's less common, but definitely can be a presentation and need to be treated. Those seizures need to be treated differently.
And you talk about the fisting. I think that's important.
Yes, so patients shouldn't be handed much before 18 months or so of age, certainly before a year of age. So if a child is, opening and closing, we want to see opening and closing both hands, bring both hands to the bottle or the midline, batting at things with both hands. If they're doing that with one but not the other, the other hand is more often than not fisted or more fisted than the other side, that suggests early weakness and is one presentation. And then the other thing that we will see on occasion is just global developmental delay. So the child is not making milestones that they should be making, or they even have evidence of a visual field cut and they're not paying attention off to one side or the other. They act like they can't see off to one side.
That is very, very valuable, and that's why I tell parents, go back when they say to me, does this mean a seizure? I say, go back and listen to how Dr. Comi describes it on here, and then they all get their phone and they start recording it, and then, so that's great way to end this. Also, you're doing consults, virtual.
Yes.
So they can get in touch with you through birthmark.org/Comi, or reach out to her through the Kennedy Krieger Institute, at Hunter Nelson, Sturge-Weber Syndrome Foundation.
Well, my email is Comi, C-O-M-I, at kennedykrieger.org.
Okay, that makes it much easier. Or they can get a hold of you through VBF at
Yep.
birthmark.org. It goes to
Absolutely.
the same. So thank you so much for being here.
Thank you.
Again, there are a lot of resources on our page, and now that we have a board member who is bringing a lot of
Right.
expertise for getting children ready for their services for school that have Sturge-Weber. We're going to be offering more options for our Sturge-Weber syndrome community, especially with early awareness,
Right.
and to do away with the old thinking that, oh, they're out of the woods.
Yeah, so
You know.
historically, and we still see it sometimes where they've gotten one evaluation and they're out of the woods, as you say, or there's nothing we can do. So just come back when there's a problem. Well, that's not true either. So yeah.
Yeah, so thank you for that, and happy holidays, and happy holidays to everyone out there.
Happy holidays.
And enjoy what's left of Black Friday. If you're one of those people that goes shopping, it's the day I stay away from the shopping and all the malls and all of that. And anyways, stay safe and happy holidays from VBF. And thank you, Dr. Comi.
Take care.